In the last episode, you heard her story as a woman, as a wife, as someone navigating love in a body that carries pain. Today, we step into another part of her life because beyond the personal journey you've already heard, there's a public one. The one that asks her to be strong, not just for herself, but for others. So if you're listening today, whether you live with chronic pain, care for someone who does, or simply want to understand what strength really looks like, this conversation is for you. Hi, my name is Jean-Pierre. Welcome to the Pain Free Podcast. This is part 2 with Eseza Kironde Ho. Eseza, let's take a look into motherhood. I want to know what motherhood has taught you about yourself, your own strength, and your own limits in raising your children.
Okay, so motherhood has been challenging, to say the least. It's not an easy journey. It's been incredible. I'm enjoying it. I love it. Like I said earlier, I have all this love to give, and I absolutely love being a mother. I love being around children. I'm that woman who always has children at my house. But limitations, I've learned that I have to lean on my so-called village to help me look after my kids. There's this saying we learned in primary school that no man is an island. So I've learned that there are days I need to rest. I need to recover mentally or physically. So I need to call on my village to help me look after my children. It's something I'm not very happy about. Like as sickle cell warriors, we go over and beyond to prove ourselves. Sometimes it's unnecessary. Sometimes it's totally unnecessary. But I've learned the hard way that sometimes I do have to call on the people around me who love me, who are willing to support me, to help me raise my children. And I have this incredible group of friends because we're away from family, we don't live near any family, but we have created this incredible group of friends who help us do so. And then becoming a mother also taught me that, I wanted children because I wanted to be a mother. But a lot of humans have children for selfish reasons, honestly. It's not because a person has to be brought into the world and we know what that person's needs are going to be. We have children because we want to be parents, or some people want to leave a legacy, or this and this, but we all have children for a reason, and that reason it's about us and our partners and never about the children we're bringing into the world. And people don't like to admit it, but it's true. And then the two reasons I became a mom, I wanted to have a family with my husband. I really wanted to be a mother. I've been very maternal since I was a child in diapers, playing with other babies. And I wanted my body to prove to me that it could make something good, that it wasn't all about pain and destruction. Like sickle cell, I'd been so sick a couple of years before I had the children. I'd had a crisis that nearly killed me right after getting married, and I was bedridden for months, about 5 months or something. Then I couldn't walk, and it was a long series of things. And I just wanted I wanted my body to create something good, something healthy, something beautiful, something that would add joy to our lives, where I had essentially, not me per se, not Eseza, but the body Eseza inhabits, had brought so much pain to my family. And I then we tried for a baby when we saw that the time was right. My health was okay. We tried for a baby, and I fell pregnant with two, and then we're wondering, is it going to be girls or boys? Okay, are they going to be identical? We didn't know for a couple of weeks, and then we found out it was a girl and a boy. And the time of pregnancy brought my family, it was absolute fear and absolute chaos in my family. They were so scared. Even after I had the babies, my brother-in-law, who I did not think was paying much attention to everything, he came to me, he's like, the babies are beautiful, please don't do this to us again, we love you too much for you to do this to us again. This is okay. But it was absolute fear. And then I had the babies, and my family, the joy and love that burst through my family, and not just my parents, his mother, and our siblings, but our aunties, our uncles, our second cousins, like the whole extended family was just, there was so much joy that year. 2016 brought healing through our children. It brought healing into my family. It brought so much healing into our family, which is something I really, really wanted. So motherhood has taught me a lot about finding my inner strength. It has taught me a lot about healing my past trauma, so I do not pass it on to my children. It's taught me more about patience. It has taught me more about looking after myself, that it's not just about me, it's about the people around me. It has taught me that life is so sacred, and it only comes about once. And even though it is the longest thing we'll ever experience, it's also really the shortest in the same breath. But yeah, and motherhood when you have sickle cell is so difficult. It's so difficult. It's emotionally and mentally draining, but your children give you the strength. And I think it also, this is not just motherhood, but fatherhood as well. When I talk to friends men with children, it teaches you strength you didn't know you had, love you didn't know went so deep. But it's been the most amazing journey, and I had children with the most amazing man, which has made it so much fun. Having a parenting with your person, the person who understands you and loves you and loves their kids, makes it so much easier. So yeah, it's been good. It's been good. I'm really enjoying it.
I can relate to the journey of having sickle cell and the fears, the uncertainty, and the dependence on a really robust support system. As a mother, I'm sure there's a part of this journey, your journey specifically, that is not pleasant, especially for your twins. How do you protect them from the parts of this journey that might be traumatic, that you don't want them to see or even inherit?
So what we decided we decided before we had kids, I was going to be very open with them about sickle cell. Not that they're privy to everything I'm going through, but they are aware. So soon after they were born, I was diagnosed with vascular necrosis of my shoulder. And if you know vascular necrosis pain, it's the worst. And when it's in your arm and you're dealing with two babies, because I think I was diagnosed when they were 4 or 5 months old, and they wanted me to have the operation then, but I couldn't have my arm in a sling for a year when I have baby twins. But from then on, we decided, okay, we're going to tell them about sickle cell slowly. We're going to tell them what sickle cell is, age appropriately. So we started doing and explaining to them that, okay, Mama's not okay. Mama's not feeling well today, so Mama can't really play. They knew I'd put them down on the bed when they started like sitting, or I'd put them on the bed or on the floor in a little pen, and I'll fall asleep by watching them while dealing with the pain. But they've been very aware of my journey. They don't know the nitty-gritty details, but they are aware of what I'm going through. They know my doctor's names, they know my medication. Some say that children this young should not know anything about sickle cell, but I tell them that the sickle cell is affecting them anyway. Even if I do not tell them, it's going to be affecting their lives. There's times when I'm in hospital for 10 days and we need to figure that out. There are times when if I'm not in hospital, I'm in bed for 2 weeks and we still need to go about our lives. So we start dealing with it now so that they mentally they can start working on it, and emotionally we're dealing with it in that way. Also, when they say, they might be too young to understand sickle cell, deal with it. I was dealing with sickle cell from the age of 18 months. I had to deal with it. They could not hide it away from me. It's something I had to learn to live with. And it's not directly affecting them, but it does affect aspects of their lives. If I'm having a bad week, it might cause them to have a bad week at school. So we've been very open. So the twins have been quite cute with understanding sickle cell and how it affects my body, what hurts, what does the pain feel like. My son is more scientifically minded, so he'll at the age of 3 he's like, but mama, how does one get sickle cell? How come I don't have it? Well, my children have it, but this is a 3-year-old. And it was 11 p.m. one night and he couldn't sleep because he needed to understand. So I pulled out a piece of paper and I did that. What is that square called? The Punnett square. What's it called? The Punnett square, the genetics Punnett square. And I showed him that, okay, this is how sickle cell is inherited. And he's like, oh, okay, so I am AS, you're SS, and Papa's AA. And I'm like, yeah. And then what will happen if I marry someone who's AS? And then I showed him. And he's like, oh, I can't marry anyone with AS. My babies might be sick too. But he's 3 years old. And then he's like, but where do you find sickle cell in the world? So I showed him the map. They both know the sickle cell map. And then one day we were at the clinic and he sees the malaria map. And he's like, Mama, that's the sickle cell map, but it says malaria. And I'm like, yeah, remember the two go together. And a couple months ago, I've never talked to them about the cure, the sickle cell cure being available. Well, not available, it exists, but it's unattainable for some people. And he's suddenly like, Mama, but if we can do cloning and we can play around with genetics, can't we cure sickle cell by playing around with your genetics? I'm like, yes, baby, we can. The cure already exists. He's like, what? Why don't we get it now? But his little mind had been working so hard. So you can see he's always thinking about how it affects me. My daughter, on the other hand, will bring me juice, and if I ask her for certain medicine, she'll know where to find it, but she knows not to play with mama's medicine at the same time. She'll know I need rest. She'll know I need maybe a cup of tea. If I'm not feeling well, she'll make me a cup of tea, or she'll bring me a snack. So we've learned that it's part of our lives. It's the fifth member of the family, not present in body but present nonetheless. And yeah, we get by. Now they also know that in the future they have to pick their partners wisely, because they do not want to have children as sick as their mother. But I'm happy with the decision we made to talk to them about sickle cell from a very young age. It was a very good decision. It's helped with their maturity levels. The one thing, though, is when I fall sick, is they do get the scare of, because one day it struck about maybe at the age of 5 or 6, they asked me, Mama, does sickle cell kill? And I didn't lie. I said, yes, it does. So that's a fear they have and something we are working through. But it's incredibly difficult, but it's an extreme human experience nonetheless.
With everything that you've just explained, Eseza, things that you've experienced with your children, what do you think your twins will remember most, especially in watching you fight on a daily basis almost, fighting sickle cell?
I think they will remember that I did my best to fight for our future. I threw everything I could at it to fight for a future with them. And through it all, through the pain and everything, and between the doctor's appointments and everything I went through, I was present for just about everything in their lives. They can see through the pain. They're like my husband. They can see when I'm not well, but they know I show up for everything. I'm fighting sickle cell very hard so I can be a present mother in everything they do. I am therefore just about, if I can be there, I will be there. And that's what they'll know. I fought very hard to be their mother. I fought tooth and nail to be a present mother for them. So I think they'll remember that.
So tell me more about your advocacy. What inspires your work with Sickle Cell South Africa?
So with Sickle Cell South Africa, I joined Sickle Cell South Africa because growing up was quite a lonely experience. While I did know of other people with sickle cell, I did not really interact with them. And then we moved to Southern Africa, where I was literally at school. I was like the only child with sickle cell. There was no one else. I had cousins, but they were in different countries. It was quite a lonely experience. And then as I grew older and we got into the internet and social media became a bigger thing, I realized that there are more of us, even if there are other people with sickle cell around us, it's a very lonely journey. So for me, Sickle Cell South Africa has been about creating a community, creating a safe space for people where they come with their issues and they can unburden themselves. They can ask what they would think is the silliest question, but they know they'll never be judged. They can come and they can cry about being in crisis for the umpteenth time, and they will know that they will not be judged. We are all going through the same thing. I want to create community. I want people to feel supported. The other one was that I realized caregivers are also an unsupported part of our community. We cannot live without the people who care for us, but they do not get the support that they also need. So I want them to also feel seen, feel supported, know that there's somewhere they can go and commiserate. They can talk about their problems. They can talk about their highs and their lows. We need a safe space. And being part of a community where in society we are sidelined, being part of a community is a great way of helping warriors with their mental health issues. Something that we do not, again, talk about much in the sickle cell community. We do not talk about how sickle cell affects our mental health. But once you're in a community of people who understand you, who are going through exactly what you're going through, it becomes easier to deal with. It becomes easier to talk about. So this year, unfortunately, our four directors, we have been quite unwell. um, you know how sickle cell is. When you are sick, you're sick, and other things do not take priority. Your health does become the main priority. So we haven't done much this year. We've been trying to regroup and figure out admin and all of that. But next year, in the new year, we're looking into having more blood drives, more community outreach projects. We need to get into the hospitals, talk to doctors, find more people with sickle cell, educate more doctors on how to deal with people, and nurses on how to deal with people with sickle cell, how when someone comes in pain, it literally is an emergency. It has to be dealt with there and then. We are hoping for more collaborations with other associations around Africa and around the globe. We need more donations for us to do what we need to do, because a lot of things are coming out of our own pockets. So yeah, we're looking into. Some of our members are working with a group that had worked on a project that teaches researchers how to work with sickle cell patients as partners in their research. How we're not just a source of data, but we can actually be part of the team, and that was quite interesting for us. So yeah, in South Africa though, work can be quite difficult. Sickle cell work can be quite difficult to deal with because it is a very rare disease. But we have gotten some exposure. We were on. Myself and the other director, Solange, we did an interview on a TV show. It was a live show. We did an interview for about 10 minutes talking about sickle cell during Sickle Cell Awareness Month in September, and we got quite a bit of traction there. So I'm hoping we can get a bit more done from that and get more people joining our community, and there we understand more of their needs and deliver more of what they need from us.
And as a director, what is the hardest part about carrying the stories of so many warriors and representing them not just within South Africa but beyond borders?
But the hardest part of it is that these people are going through a lot. When we walk through society, like let's say you're walking through a mall or you're walking down the street, every person carries a story, and some of these stories are totally heartbreaking, totally and completely heartbreaking. And some of the things people are going through are unnecessary. They are unnecessary. People are dying because they cannot afford painkillers, or they cannot afford medical bills. People are dying because society will not listen to them, and they will not listen to their pleas. People are suffering over the smallest things. And the hardest thing of it all is sometimes all someone needs is just a bit more money for their life to be bearable. And I don't have the money to give. Sickle cell is a very expensive illness to deal with, and people are dying simply because they don't have money. because sickle cell is so difficult. It messes with your whole life, that some people cannot work, and then sometimes their family members cannot work because they have to look after them, and it's this horrible cycle that's repeated over and over again, and they're dying because they don't have money. Medication is inaccessible. Cures are inaccessible because they are so expensive. It's not fair. It's really not fair. And a lot of our governments are not doing enough for sickle cell warriors. Sickle cell still stands as the most common genetic illness in the world, in Africa, and our governments are not doing enough for their people. We have been discarded as they don't live long enough, so they don't have anything to contribute to society, so why must we invest in them? And for me, that is it's really so difficult to deal with how much people are suffering, because the government will not invest in the healthcare system. It will not invest in sickle cell care. A lot of my friends with sickle cell are brilliant. They are running organizations. They have multiple businesses. They have careers, and they're handling that with the sickle cell. Well, the bills have to be paid, so the career has to be had. But if you give someone a chance, their life could be more manageable, and society is not allowing that. People are suffering for absolutely no reason other than society refuses to invest in us. I always think about I'll meet someone and I will not know what their story is. We never think about what the next person is going through, but people are going through so much, and sometimes the stories are just so difficult to listen to. So difficult to listen to. Doctors don't know enough about it, and some don't even care to know enough about it, because again, sickle cell warriors are not going to live long enough, or if they are adults, they're just drug seekers, so why are we investing any time in them? Our community is suffering for no reason. So that's very difficult to deal with. You end up carrying their pain on your shoulders, and you have to, what I've had to learn is to not completely detach myself from their stories, but I cannot carry their stories. I cannot burden myself with their stories. I try to help where I can, but I cannot burden myself with it, because the emotional stress will land me in crisis. my sickle cell cannot handle emotional stress. So that's been very, very difficult to deal with, to see how we've been let down by society, by our governments, it's so difficult to deal with.
Speaking of all the stories in the sickle cell community, Eseza, if your story could rewrite the future for other warriors, what would you hope your story changes?
So, with my story, it is what I would like the younger warriors to have an easier life, like to learn from what we're going through, the complications we're getting, how we're learning to manage it. A lot of us are dealing with doctors who've never dealt with adults this old. And I'm hoping from that it will help them deal with the younger generations coming up more easily, stop complications before they come along. Hopefully now we're going to get better medication other than hydroxyurea to deal with the sickle cell. But what I tell my friends and family is that if there's one thing they should take from me is we don't need more people with sickle cell in the world. And that's a hard pill for them to swallow, because they say, but Eseza, you're so happy and you love your life and you are always smiling. And I say, yes, I'm always smiling because I'm not going to let you see me crying all the time. When you see me smiling, it's because I've taken all sorts of painkillers to kind of dull the pain that I'm still feeling. I still feel horrible when I'm sitting in front of you. If we're going out, I'm still thinking about, I have to go see the doctor about this, or I have to go see the doctor about that, or I have to deal with this, I have to deal with that. My life is still riddled with so much pain, so much uncertainty, financial constraints. It would be lovely to get the cure right now. They'll be like, but there's the cure. You could probably get the cure and that will make it easier. And I tell them, who has $2 million to get the cure? Who has, and that's the basics, that's the minimum. Who has a minimum of $2 million to go get this cure? And then they think about it, they're like, no, but it can't be so bad. I'm like, it is that bad. We just don't walk around crying. If you take anything from me, I just hope the warriors that are born, their lives will be easier, the cure will be more accessible, or other therapies to deal with it will be more accessible and more affordable. But if anything, I want fewer babies born. I don't know if that's attainable, but I would like there to be fewer babies born with sickle cell. A baby born without sickle cell is a healthy baby. When I see, when we're on these groups and all these people, I'm on these groups on Facebook and on, I see things on TikTok or Instagram, and someone be like, I have a 6-month-old baby that's just been diagnosed with sickle cell disease, and all I can do is cry for that child, because the mother doesn't know, the parents don't know, and that little baby does not know the kind of life that's ahead of them. So for me, the best route or part of my legacy will be like, I did not have children with sickle cell because Eseza told me so. But for now, I will work with my child's life is better because Eseza helped me. Now, the other thing I need to add on, the other thing that parents love, because a lot of them are told their children will not live to see the age of 5 or the age of 20, and then you come along and you tell them, well, I'm almost 37, I have twins, I'm married, I went to university, I did this. Some of my friends have careers. I don't work because of medical reasons, but my friends have careers, and that gives them a lot of hope. That does give them a lot of hope, and they'll ask questions on how to improve their children's lives, and that's for me, it's great. But I would prefer a world with fewer children born with sickle cell.
As we come to the end of this episode, I want you to sit with what you've just heard for a moment. Today wasn't just about sickle cell. It was about what happens when pain lives in two places at once, in the body and in the heart. And what struck me most in this conversation was not just her strength, her honesty, but the courage it takes to love, to commit, and to keep showing up in a body that doesn't always cooperate. If you're listening and you carry pain of your own, visible or invisible, I hope this episode reminded you that you're not weak for feeling it, and you're not alone in navigating it. So if this episode resonated with you, take a moment to follow the podcast, share it with someone who needs to feel seen, and until then, take care of your body, be gentle with your heart, and remember, healing doesn't always mean being pain-free. Sometimes it means learning how to carry the pain with compassion. Love, always and forever. Jean-Pierre.